So a lot of people that end up in my office usually do so because physical therapy in the past has failed. And there's a couple reasons why this is. Most of the time, by the time someone gets in here, they have two things going on. They have pain, which acts as a check engine light. It tells you that there is a problem, but it doesn't necessarily tell you what the problem is. So they have the pain component, and they have an underlying component that has caused that pain. Maybe something's not moving right and you're having to compensate in other parts of your body. Maybe you're not using the correct muscles to do the activity. And so other muscles that aren't designed to do that are now having to step in and do that job. And so if we don't address both parts of this, the pain, making that feel better, but more importantly, getting to the root of the problem, the underlying issue, why did that tissue get angry, irritated, painful to begin with, then we're not actually going to solve the problem. So what you'll see a lot of times is people are either treating pain with medication, injections, or even they're going to physical therapy, and that physical therapy is focused on pain control. It's great. It helps them feel better for a short period of time. But then that pain comes back because the underlying cause was never addressed. And that joint or soft tissue is again getting irritated and the problem comes back up. Or maybe it manifests in a different area of the body. So to do this effectively, what we need to do is address both parts of that issue. We need to get the pain calmed down, and we need to find out why the pain began in the first place and address that. And when we do that, we get a lot more complete resolution of pain and symptoms in the future. On top of that, we're probably preventing other problems that may arise. So that's one big reason why physical therapy and other treatments fail sometimes and why people end up in here is because we just address the pain and not the underlying problem. But that's not our approach at Value Physical Therapy. Now, the other reason some people end up in here is that they don't go through a complete plan of physical therapy care. Physical therapy is not something that's going to take care of your problem in 1 or 2 visits. There is no quick fix. The reason you develop pain most of the time, especially in an injury that comes on out of the blue, is because you aren't moving right. You're using the wrong muscles. And so we need to spend some time going through the different phases of rehabilitation to teach your body how to move correctly again. We need to make sure that you have the right mobility in the right joints. We need to make sure you're using the right muscles to do the different activities you're trying to do. When you're walking, are you pushing with your glutes or are you using your back? So we need to teach your body how to do those things, and those things take time. Unfortunately, while we're treating those, early on in the phases of rehab, most of the time pain's getting better. And so before people fully retrain the muscles how to move the right way, they decide, I'm feeling better and I'm going to stop physical therapy. Well, we didn't quite get to the point where we've retrained your body enough to address the underlying problem. And unfortunately, if you cut this off too soon, the pain's going to come back because the problem is still there. So we also need to make sure that you're going through a complete plan of care that not only finds and addresses the underlying problem, but trains you how to move well again, and then incorporates that into the activities you love doing and you're having trouble doing, like running, hiking, biking, whatever the activity is. So those are the 2 big things that I wanted to talk about today. You know, I hear a lot of things from patients about how physical therapy didn't help me in the past. I just want you to consider, did you go through the full plan of care, or did we just address symptoms? Did you have a plan that not only fixes the problem, but continues to help you after you discharge from therapy? Because that's important. Thanks for watching this. I hope you found that helpful.